All right, we've already draped the leg using the safety drape. And you want to apply your oil, lotion, gel, whatever it is you like to use. Pressure okay, Katie? And so we're going to be demoing Therapeutic for the anterior foot and lower leg. And because I'm doing just the lower leg, I cover her back up for her comfort. Okay.
Adjust the foot, sit or kneel using alternating thumbs. Work laterally, adjust the medial and transverse arches. Gradually go deeper, try straight strokes.
Is that pressure okay, Casey? So what I'm doing here is I'm taking my thumbs and I'm pushing laterally, just like we do when the client is prone. Then you spread like so. All right.
Use soft fist, same place and direction.
All right.
Using pointed thumbs, work plantar fascia and the intrinsic muscles of the foot from heel to toe. Repeat until the entire sole of the foot is uncovered. Deep work here helps avoid the tickling sensation.
And so what I'm doing is shimmying all the way up the plantar surface of the foot, just like so, until I cover the entire surface of the plantar. All right.
Work each toe and its base firmly.
Got to get the little toesies.
Make nice with Swedish strokes, remembering to always finish
Centripetally. All right.
Adjust the ankle, rock the joint to loosen it, and both hands cupped around malleoli.
Now, when they talk about rocking the ankle, they're talking about this right here.
Circles at malleoli with their eminences, then fingers and thumbs. Indian rub at rim to match.
So just like in a prone position, now being in a supine position, you're still going to do the same kind of Indian burn move. All right.
Address tibialis anterior. Use forearm, heel / palm, 3 fingers.
Now, before I dig in like that, I always try to warm up the tissue just slightly, because a lot of people are very sensitive in this area. A lot of people think they have shin splints, and they actually don't. It's just where the muscles have adhered to the periosteum, and it will not allow for the free movement of the muscles because it pulls on the periosteum, which covers the tibia and the fibula. And then I will do a spreading stroke. Okay, now read that again about addressing the tibialis anterior.
Use forearm, heel / palm, and 3 fingers.
Okay, I start with the heel of the hand, addressing the tibialis anterior, which runs right up along there. You okay, Casey? There's 3 fingers. And then there's forearm. Now you got to be real careful about using forearm here. All right.
Address peroneus longus and brevis. Use heel/palm, 3 fingers. If you have trouble finding it, have client invert their foot, go all the way under the lateral malleolus to lateral arch of the foot.
Okay. So it actually starts right around here and comes around this way. And now I'm using 3 fingers. Okay.
Use the thumbs to separate tibialis anterior from the peroneals. Start just superior to ankle and proceed Work slowly and deeply, feeling for crunchies, asking for feedback in response to depth. And then
Okay, you good, Casey?
Mm-hmm.
All right. So now I'm in between those 2 muscles. Now, to find them, look, see if I take and flex her foot, and then I plantar, see how it pulls there? See, I may have the light where you can't see it, but do you see the muscle right along there? And so that right there is the tibialis anterior, and the peroneals are here. So I'm right in that space in between them, which is where a lot of people will have adhesions. Oh, and the word is centripetal, which means everything flows towards the heart. So you want to make all strokes moving towards the heart. All right, what's next?
now sculpt around tibialis anterior and peroneals with soft fist, then petrissage.
Okay, so you can do a soft fist right here. I tend to use the palm of my hand because, again, those are where your tendons and all of that attach for these muscles, and that can be kind of sore on some people. It's a little less abrupt. All right.
Address the gastroc and soleus at medial calf. Use heel, 3 fingers, and pulling strokes.
Okay, now I'm warming up the medial side just slightly because that's also a very tender spot. Especially because of the fact you have the pans ends ring tendon that comes in and attaches right down here also. Okay, so I'm using palm pressure. Now I'm going to 3 fingers. Are you okay, Casey?
Yeah, it's a little
See, just a
hurtful.
little. All right, I'll ease up just slightly there. All right. Now I'm going more flat surface of my hand. That's more of a myofascial stroke. Okay.
Run both thumbs up either side of the tibial shaft at knee work medial and lateral sides of femur, tibia, and fibular head.
Okay. I think I might have missed the part where it petrissage, the inside of this. Okay, now it says run both thumbs up the tibial shaft. Now, again, this is where it gets a little tender because you had that periosteum that's right there across that bone, and the muscles on this side are attached to it, and the muscles on this side are attached to it. So you have a lot of adhesions that will form in these areas. Yep, I feel so. Okay, so I'm gonna go in and just kind of warm it up a little bit with palm pressure. Now I'm going up one side at a time. I don't do both sides. Okay, right there we have one. So I just kind of do like that little windshield wiper motion with my thumbs until I feel it melt away. How's that, Casey?
Good.
There's another one right there. And that one is melted away now. Yep, and we are clear in there now. And I flush it out. Now I'm going up the lateral side of the tibia shaft to see what I feel. And I feel a little something right in there. Here it is right in there. So you can do the little windshield wiper motion, or you can use thumbs on it and go like so, like right there. And then you can do like that to get them to melt away. And then I will sometimes take my thumb and push away from the shaft itself in order to free that periosteum up. And that's not on your paperwork, but so I'm doing like so. So I have my thumbs on the shaft and I'm going that way like that to help pull the muscle away from it just slightly. And then I do the same thing on the medial side. Now, this is not on your paper, but I also work on trying to free up the periosteum by just doing a myofascial stroke up it. And then that's myofascial chucking. All right.
How to work the knee using fingers and thumbs include patella, patellar tendon, and its lower quad attachments and surrounding area include fibula.
Okay. So this routine for the knee is exactly what I teach in Swedish. You come up both sides. You can address both heads of the tibia and the fibula, and then of the femur. And then as far as the knee is concerned, I do a little petrissage, a little finger work around it. I address the tendon, patella tendon, and a little cross fiber friction over the knee. Okay.
Return back down the calf with squeezing strokes. Push fluid up while moving down.
And so that goes back to that milking that we were doing when the client is in a prone position. Okay.
Redrape the leg, and you can put those.
I say, thank you, leg. How you feel, Casey? All right. And that ends the foot and lower leg therapeutic.